Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. Doc, on today's show, we want to talk about something that is not as common. You don't really see a lot of it on TV or advertised, but it's definitely a problem that's out there. It's called piriformis syndrome. And we've had some people write in who have had this type of problem. It's kind of like that pseudo-sciatica problem. So what can you tell us about piriformis syndrome?
Piriformis is basically a muscle that starts from your sacrum and goes over to the greater trochanter on the side of your hip. And it's very significant because it's horizontal and then the sciatic nerve is vertical, so the sciatic nerve goes right and pierces right through the piriformis. So people think they're having sciatica, which is a very painful thing. It's not really coming from the sciatica, it's coming from the piriformis. So what we do differently, Jared, is we treat the piriformis. You treat the piriformis, we stretching, we have a technique where we can actually release the piriformis. It's kind of like a tricks of the trade that you learn after 30 years, okay? You can get into acupuncture, you can actually adjust the hips, pelvis, low back. That helps the muscle. You can do physical therapy, muscle stim, acupuncture. It's all good, it all works.
And you know, one of the things is I was doing some research for today's show and looking at this syndrome, you know, really I noticed that it can come from anything from a non-active person who just sits a lot,
right,
to that athlete
runners,
who, you know, is doing a lot of work there. So, you know, it really is across the board. Anybody can develop piriformis syndrome.
That's right. Runners can get this, repetitive stress. People who sit all day, that compresses your spine. Anything can cause anything, Jerry, and anything can cure anything. So we look at the cause and find out why, and we correct it. 99 times out of 100, you can fix them, correct them.
Yeah, and I think, you know, again, we get back to this whole thing of, you know, say muscle relaxants and anti-inflammatories and all that. If you've got a tight piriformis that needs stretched and released, hitting it with medication is not going to stretch out that muscle or really give you any long-term relief. Maybe a short-term, oh, it feels a little better today because you've numbed it, but it's really not addressing the true problem of what piriformis syndrome is.
Yeah, because you're just treating the symptom of the condition, you're not treating the condition. So therefore, if you're going to continue to run while you're taking the drugs or continue to sit and not stretch properly like we're going to show you how to do, then it's just going to get worse.
Yeah.
Okay?
And you know, one of the things that we've got to stress to everybody is that if you've got, and this could start off kind of like a toothache type thing, you know, and you might think, wow, it's nothing, but you know, that's really what we've got to get everybody to understand. When you're feeling those dull aches and those kind of, you just don't feel right, there's a reason for that.
Yeah.
And that is the time to come in and meet Dr. Goldberg, get checked out, look at their overall history and find out what's causing that problem.
So your body's your friend, Jerry. I don't know if you've ever heard this, but so your body communicates with you. It doesn't know English. So it's saying, let's find out why you have this problem here. It's giving you a pain, pins and needles, numbness, or burning. That's a pinched nerve. So it's communicating with you. It wants to get your attention. And it's saying, let's find out why you have this and let's fix it. Now what you do is you take a drug, you're suppressing the communication. So we say, listen to your body. Your body's your friend. And find out why you have the symptom, and let's correct it. Let's fix it. Let's not suppress it. We want to get to the root cause.
Yeah, I mean, I think our goal, you know, as we talk about changing healthcare and all that, would be, you know, we've got to get away from all the medications, all the drugs, and allow our body to do what it does best. We can't keep, you know, bombarding our body with all these external, you know, things.
Chemicals.
You know,
They're chemicals.
Right. And your body doesn't need them. Your body can do tremendous things if you set it up correctly. If you're eating correctly, you know, proper nutrition, proper, you know, adjustments and functions of your body, it's amazing how efficient this body can be if you just give it what it needs.
Suppose you have a drugstore within your body, Jerry. Your body produces its own drugs, okay? Life heals. Your body wants to be well. So you know how the computer has a default setting? Supposedly, Jerry, we have a default setting. You know what the default setting of the human body is? Health and wellness. We're not supposed to be sick. We're not supposed to be in pain. How do I know, Jerry? Because I'm not sick and I'm not in pain.
Right.
So my default setting is health and wellness.
Yeah.
So if something's not right with me, Jerry, I want to get it right. So if something's not right with Johnny or Susie out there, you want to find out why you're not right and you want to get it right.
Yeah, and I think it's, you know, we've got to get into the prevention aspect, the understanding our body, listening to our body. And I think if you'll just start there, you know, just listen to your body, make these, you know, these proper adjustments, come in, meet with Dr. Goldberg, meet with the staff here, look at everything. And you know, a lot of times, and we'll be honest with everybody, there's going to be times when you might tell them something that they don't want to hear.
Truth
Okay?
hurts.
You know, I mean, and it gets back. It could be a nutritional thing. It could be, you know, you can't,
Change. It's change.
right. You cannot continue to bombard your body with all these bad things and expect it to bounce back all the time.
Yeah, we live in a cause and
You know?
effect universe. So if you're doing a cause and you got effect, you got to change the cause to change the effect. If you just keep doing what you're doing, do you ever hear, if you keep doing what you're doing, you're going to keep getting what you're getting.
Yeah,
That, you know, that's my definite insanity.
Yeah.
Okay, and when people come in our office and they get the adjustment, they get the nutrition, they're well-adjusted people, they're stabilized, and they stand corrected.
Yeah.
Now, what a beautiful thing.
Yeah, you've got to, I mean, to really appreciate it, you got to give it a chance. I think that's the big thing. You got to give it a
Right.
time frame and just see how you start to all of a sudden you're feeling better. People start asking, well, you know, what are you on? You're smiling. You kind of got that bounce in your step a little bit.
That's right.
You know, and really that's what chiropractic care can give you. So, you know, we hope you found this to be educational. If you've got a piriformis syndrome or any other type of problem, but you know, as always, you know, what we stress is make chiropractic part of your healthcare plan and your healthcare team. I think that's if you don't have a chiropractor on your healthcare team, you're missing a vital part of that health puzzle.
I think in the future, Jerry, people are going to go up to people and say, who's your chiropractor?
Right.
And you better have one, because if you don't, you're missing out. It's like today, who's your dentist? Everybody has a dentist. In the
Yeah.
future, everybody's going to say, who's your chiropractor? Well, I have a chiropractor. If you don't have a chiropractor, it's like, what's your problem?
Right, right. Yes, you know, success in living a long, healthy life is about having a good team around you that can address all these problems, and chiropractic really needs to be a focus in your plan. So with that, we really appreciate you spending some time with us. We hope you'll pick up the phone, call Dr. Goldberg down here, schedule an appointment, utilize their new patient free evaluation program, and just come down and experience of what this place has to offer. I think you'll really find it enjoyable and an experience that you'll want to repeat and come back with. And your friends and neighbors and coworkers are going to ask you, what are you doing? And you're going to be able to say, hey, I go down to Wellness Associates. You got to go down and see Dr. Goldberg. He can help you out. So thank you very much for watching our show today. Continue to check back. We got some great shows coming up and some great information that I think you'll find very informative. So thanks for watching, and we'll see you on the next episode.